Technology can make the world better, but we've got to work together. At UST, we're building a future where
businesses are built to thrive.
AI helps me get to a diagnosis faster. We can automate the basics and focus on what really matters.
Security is built in.
And people everywhere are empowered to live better lives.
It's transformation you can feel.
And you don't have to do it alone.
we believe in the power of technology to transform businesses and build a better world. UST.
Welcome to this exciting case study reviewing UST's prefab biotemplate for SAP S/4HANA Life Science implementations. I am Bruce Harriet, the head of Canada for UST, and really happy to be joined today by Chris Chambers, who's going to talk a little bit about the UST and the prefab biotemplate. So Chris, welcome. Thank you for joining us. Maybe you could tell us a little bit about yourself and a little bit about UST.
Thanks, Bruce. Really excited to be here. And yeah, I'll start giving you a little bit of background about myself. I started in the 90s in the consulting world, and SAP at that time was becoming very prominent as the kind of the definitive ERP system. Quickly graduated moved and evolved into regulated industries with a huge focus on life sciences. So probably by the year 2000, I was almost exclusively focused in life sciences. And that presented a great opportunity to build some capabilities and understanding around the themes associated with life sciences, particularly around good practices or GXP, computer systems validation, and some of the themes that you would see with anything not just in life sciences, but anything that's regulated. So which was subject to expiration dates, regulatory oversight, and the testing and rigor involved with implementing solutions, and particularly in the manufacturing and quality space. It's been especially exciting to drive that into the template that we're going to discuss today, and we believe at UST it's a major differentiator in which we can provide huge value for our clients. And I'd like to get into why that is by talking through some of the traditional challenges in this space, focusing on not only how we accelerate, but how we don't really lose and maybe even enhance the quality of our solutions, despite doing it in an accelerated fashion. Talking about the differences between a standard implementation and what we have with the solution. And I do really want to highlight, it's important for us to not compromise any of the key challenges that often undermine implementations: change management and training, data, testing, things that can't be compromised organizationally. But even in those spaces, showing how we have a solution that is not just a configuration solution, but a solution that helps us accelerate in those spaces as well. That will be a huge focus of the business benefits, as well as the case studies that we get into where we've actually implemented the solution with our customers to great success.
Oh, excellent. Looking forward to hearing it. Thank you.
So Bruce, UST in general has existed since '99 and has really grown rapidly and expand to now a $1.9 billion business. Our corporate office is in California with about 30,000 global associates with a great presence globally, which is obviously very important in life sciences where there's a huge global presence in general. You will see that we go way beyond life sciences and have a lot of great digital solutions. But of course, our topic today being life sciences, it's important for us to underscore the fact that we've worked with 7 of the top 10 pharma companies. We've done a lot of collaboration and really getting together, in groups as an industry to drive solutions that's involved collaboration. What's exciting now in life sciences, as we all know, is there's a major disruption going on with personalized medicine. And since we've mapped the human genome, it's afforded us a great opportunity to treat disease at the genetic level, so that we can treat people with certain dispositions. We can actually change genetic makeups for genetic disorders, exciting drugs like CAR T to treat cancer, and all of the amazing upgrades and incredible research and development that's going on right now with a lot of small biopharma companies. And many of those companies are looking to drive themselves onto an ERP platform in which we can provide many of the benefits that the large pharmaceutical companies had really invested in, while not spending the same amount of money that they did for some of these smaller companies. And that's really a major theme of the prefab biotemplate that we'll get into. So UST has very deep life science expertise, and I will say that's true not just related to SAP implementations, but really as a domain. So we all know, being in life sciences, the themes involved. I mentioned GXP before, computer systems validation, tech transfer, drug development, early stage formulation, and then supply chain quality, manufacturing, electronic batch records, the things that are very specific, LIMS integration, laboratory information management systems. So those are digital solutions, but really understanding the business processes around them is critical to being able to get the benefit out of those digital solutions. So it's kind of combining that domain expertise, knowing how to solve common problems to the industry so that they're not treated as bespoke problems each time, but then leveraging rapidly changing digital solutions, which of course we all know heavily focused on automation and AI, but also involve the building blocks of enterprise platforms like SAP to build upon some of those automations. So when we talk about life science domain expertise, we think about it as 4 circles. We've always said you can spin any of these 4 circles and stop anywhere, and we've had an engagement like that, which is critical. On the innermost circle, it's your classic SCORE model, supply chain operating reference model. So plan, make, source, deliver, tech ops and IT and quality and finance. But you also have the value propositions in the second circle on top of that, being able to handle end-to-end business processes, understanding how SAP, obviously, which is our focus today, or QMS systems, tons of business integrations with acquisitions. How can we provide value propositions on top of that? Of course, the third most inner circle is the domains that we work in, the verticals, very focused on life sciences, but not exclusively. We've done nutraceuticals, actually food, consumer products. And then, of course, the method of engagement or the delivery model. Typically, for the prefab bio template, it would be a fixed bid statement of work, because part of our template is very quickly understanding size and scope, so we can give our clients a confidence that we can indeed deliver within the size, scope, and budget that we define up front. And that's important because we do know the pain of change orders and kind of moving the goalposts, and we very much want to be out in front of that. And our template assures our clients, particularly when they talk to some of the customers who've implemented it before, that we won't be changing those goalposts unless there's some major change to the project. Just a quick flash of logos. Folks always do this. The only thing I want to highlight is this is a mix of very large companies, and that was probably most of the focus in the last couple decades. And then what we call mid-market companies. You'll see a lot of bio companies out there, but these are companies that want to take advantage of SAP's platform. And to be fair, SAP has themselves really made a huge effort to make this more accessible, these solutions to smaller companies, just because historically SAP had a bit of a stigma with being very expensive, long lead time projects. SAP moved that needle pretty well. Agile methodology called Activate, accelerators accessible publicly, all those things. But in life sciences, it needed much more movement, and that's where we think we've kind of significantly closed the gap, and I'll be getting into a little bit later. Finally, I do want to focus a little bit before we get into the template on what differentiates UST as a whole. And I think I'll hone in on this space in particular. So obviously, huge focus in terms of our SAP credentials. We have really lived in the SAP world for a long time. And in life sciences, that is most of the industry. For obvious reasons, as you'll get into later, SAP has been out in front. They have kind of the longest history, and I'd say the longest history in process industries. Most ERP systems are focused on discrete. They all started with making widgets. SAP really started in the 90s, focusing in on process industries, which gave them a big leg up, as well as their private cloud, which I'll be getting into later. And we have really differentiated ourselves in that space. SAP gave us a Pinnacle Award a few years back. SAP has about 20,000 partners. They only give that Pinnacle Award to 10 partners out of that 20,000 per year. And we were one of them. And the reason for that is because of our life science and SAP credentials, specifically in life sciences and specifically with the private cloud. We certainly focus on a customer-first approach and having long-term relationships that are based on a fundamental principle of we want to solve our clients' problems and make the clients self-sustainable. We don't have a business model that seeks to have our clients dependent on us. We know that there's no shortage of business problems that our clients are going to have, and we want to be the ones that that our clients collaborate with and trust to solve those business problems. The more we do that, the more we can become a trusted advisor and bring value to our clients. That's our business model, and it has served us very well. Also say our values-driven culture is part of that. I think when we talk about just in professional services in general, what differentiates companies, it's their empathetic willingness to listen, to collaborate, to drive vision and thought leadership when it makes sense, to step back and actively listen when it makes sense, and really ultimately to collaborate while providing value. And that's a balance that we've struck really well in our business models. You would see it reflected in all of our methodologies and engagements. It's fundamental to our culture. Obviously, these things are great and core tenets of any professional services firm in SAP, but having that deep industry experience in pharma and bio heavily differentiates us here. We're very proud. And this is one of the areas where it's not just the solutions, but it's the people. It's obviously a people-based business. People that understand these business problems, have faced them before, can speak the language, but then, strategically and prescriptively apply these solutions to those business problems. We do take a concerted effort to focus in on select clients. There is a balance that you strike in this business of being too diluted. If you're chasing large numbers of clients and all of a sudden you can't focus in detail on those client solutions. So we do focus on retention with our clients, being long-term partners, whether we're actively involved with them on an engagement or not. And it's important for us to give that level of attention. And as soon as we feel that it's compromised, that's an indicator to us that we may, be needing to focus more and may perhaps even say no and not dilute ourselves in certain situations. So very important that we stay customer focused.
So Chris, maybe you can tell me a little bit more about the prefab bio template.
Yeah, getting specifically into our topic today, it's important to understand that the industry in general, software, is moving towards cloud and has been moving. So I shouldn't even say moving because it's been something in flight for a long time. It has some challenges, and I'm going to come back to this slide in a second. But when you look at the public cloud, which is a cloud solution that everybody gets, and there's quarterly upgrades, there's some challenges associated with that aren't as conducive to life sciences. This shows some of them here, and I think, of course, one of the challenges historically and the reasons for moving to cloud is the expensive infrastructure and maintenance costs of having on-premise solutions, which is the old SAP paradigm, and that's something that the cloud is intending to replace. Obviously, there's economies of scale with having a cloud solution, and not having clients have to worry about their infrastructure is very significant. But on top of that, in life sciences, you're going to see several listed here: compliance and regulatory, security, auto-pushed upgrades that are not as conducive to life sciences. And the reason for that is really the GXP component. And that GXP component, that good practices, requires an extra level of rigor with respect to testing and compliance, particularly in areas that directly affect the product that's going to be ingested or consumed by a human being. So you're talking about manufacturing processes, inventory, quality control processes. And because of the nature of that GXP compliance, there's an extra level of rigor that is involved every time there's a functionality change to the system. So you make a change to the system, you got to go through significant documentation, signatures, and lead time associated with retesting that functionality to make sure that you're not compromising what is essentially driving the manufacturer and control of that product. And for that reason, public cloud solutions are a little trickier, because public cloud solutions usually have quarterly upgrades, or at least periodic upgrades, that will force you to examine potential regression testing that you need to do, something that becomes particularly tricky if you have integrated to, let's say, manufacturing execution systems or quality systems. So SAP has highly differentiated themselves here with their private cloud solution. It essentially has all the benefits of being nimble in the cloud from an infrastructure perspective. But in that solution, you own the instance, which means you don't have any upgrades that are pushed. It's essentially like an on-premise functionality code base. And on top of that, SAP's provided a bunch of GXP documentation, something called IQ, installation qualification, in which they provide all the documentation. So having a private cloud solution that balances the robustness of traditional on-premise pharma with the nimble, less infrastructure costs, is where SAP has differentiated themselves. And this is the basis on which we built the prefab bio template.
I see.
So getting into the prefab bio template, SAP has made a huge effort to make their solution accessible to smaller companies. That kind of put a lot of accelerators out there. The business model has changed, but there was a lot to go in terms of life sciences. So in these core functions that you see here, and you have non-GXP pieces like finance and procurement, and then GXP like manufacturing, quality, supply chain. Those are areas in which we've essentially built a pre-built solution. And a lot of folks say, that they've done that, and there's a lot of, I would say templatized configuration out there. But when we talk about the prefab bio template, we're talking about something much bigger. And many folks know the configuration is not the biggest of your problems with respect to going live with SAP. It's all of the compliance validation piece around it, the change management around it, the data around it. These are the pieces that you would really need to focus on as your long lead time potential risk factors. Let me just be clear, many of these items we've seen so many times. So if somebody says they're going live with stockroom management, which is warehouse management, or our electronic batch record solution, which we built in UI5 in SAP, which is highly differentiated. SAP themselves doesn't have a solution there. We've been doing it for bio companies for a long time. We know what those user requirements will be. We need to go through a questionnaire, answer basic questions. So taking historical testable user requirements, explaining what, and I'll just use this as an example, what the system should be doing, and combining it with AI, generative AI. So you can ask the questionnaire, what's the functionality and scope, and it spits out a fully baked in URS. Why should our clients be paying money for consulting hours for that work when we know that it's already built? And it's not just that, it's the time involved. It's also kind of the questioning of it. These are tried and true techniques. And I certainly am not, setting the expectation that our clients just accept these things. We need to review them. But we believe that the model is changing. Traceability matrix, which is the link between the URS and test scripts, should already be clear if you have a set of test scripts and a URS. And you should even be able to link them to the steps. People spend a lot of consulting hours doing those things. It's not just the costs, it's the time. Why don't we have that ready? This is the question that we asked ourselves, and it was the genesis of building the prefab bio template. So there's a very compelling title to this presentation today, and it's something that we alluded to here. Implementing in 3 months after system provisioning. In one case, we actually did it in 33 days. And it doesn't mean that we started there. We had to do a lot of work in our own system and things, but it was because we had a lot of these pre-packaged, tried and true deliverables. And you certainly need to pay a lot of, you need to go through the rigor involved with testing, even if it's a computer systems or computer, not validation, but risk-based approach or CSA approach. So all of these accelerators are the core tenets, and you can see the list here. And I again want to highlight the fact that there is a pre-configured design, for example, a CDMO design, contract and development manufacturing organization. Many of these things we can do in advance, but there are key aspects, data migration, change management, and testing that we know can't be compromised. We can do a lot of things to help that process. We certainly have a lot of accelerators. Even in the change management space, we've invested a lot in ProSci methodologies like ADCAR and ways that we can, in a very structured way, organize the impact. But you can't compromise those things. That being said, you can dramatically reduce and even facilitate those activities if you have a lot of these tried and true deliverables completed. And the other one that I would like to mention is prepackaged RICEFs. RICEFs, and I'm always hesitant to just go over acronyms without people understanding them, are reports, interfaces, conversions, enhancements, forms, and workflow. And they're typically ways in which we supplement the standard SAP design, in our case, for things that are specific to life sciences. We've been doing those for so long, and we've worked with so many large pharma companies. Why don't we have them done already when we start the project? For instance, we know that there's a gap in SAP, that anyone that knows SAP knows this, that when batches expire, they don't automatically move to block stock. That's a small, program that we write typically at midnight, the day that the batch expires. We want it to move to block stock so it doesn't get considered by MRP. That's not available in SAP. We have a customization for that. We don't want to charge our clients for that. It's done already. Part of the value proposition is we want them to be accelerated to 80%. So again, this is what we mean by the prefab pilot template. I will reference these with respect to the implementation, Bruce, a little bit later. This is kind of in a nutshell what that template represents.
Very interesting. So what were some of the specific gaps in traditional SAP S/4HANA implementations that made it unsuitable for mid-sized biotech companies?
Yeah, and some of it was perception and some of it was real. So when you look at the key critical factors that any CIO might be looking for in a company that had that profile, it's certainly going to be cost and speed. And so you see, speed listed there. The long lead times. At UST, we genuinely believe that there has not been the movement that has needed to happen in the space of things, of reducing time and cost for activities that could have been done in advance. It requires a little bit of a handshake of trust with our clients. We do not want to charge and spend time for things that, why is this not done? And we believe it can go a lot further. We believe, some firms believe it's cannibalizing their own business model. We believe it's in our best interest of our clients to have these done. So speed is critical. In order to have that speed, you need to have many of the aforementioned deliverables and frameworks in place. Certainly the configuration in the old days, Bruce, the SAP would give you some very generic configuration. They've been a little bit better now that they give you a best practice configuration, but not necessarily for, let's say, an intercompany tolling design, which is something life science companies do for reducing tax burden, or for a development organization that's looking to do revenue recognition on services or lab services. These are solutions which have a very specific framework, and we want that framework built to start. Certainly the compliance effort, there's been huge efforts, and there's even, a new GAMP 5 paper that's just being developed on using artificial intelligence to balance what is needed from a compliance and validation perspective. But yeah, SAP's effort to have the GXP compliance built in the private cloud, combined with our own computer systems validation practice using SAP Cloud ALM, also reduces the time versus what it used to be. We want test scripts not to be created during the project like they always were, but to be done and modularized in a simple way, and a traceability matrix to be done in advance. Obviously, a huge theme and sometimes it gets compromised, is a fit to standard. We don't want to customize our solutions. Unfortunately, life science in general, particularly large pharma, has a pretty bad history of highly customizing, in many cases with big value. But what that means is it's tricky to do upgrades. That's why many of them are hesitant to do upgrades, and there's challenges. So low customization is important, not eliminated, but important. We focused on a lean model, and I would say even pre-COVID, we focused on the remote model, in which the things that human beings need to be in the same room for, which is facilitated workshops and whiteboarding, we don't compromise. We kind of focus in on those key periods for things like blueprinting workshops, solution confirmations, obviously testing, being together. All other processes we try to do as virtually as we can, and with less burden on the people that actually need to run the business. Because obviously in the case of mid-market companies, you don't have the old model where you can just go into a war room for a year. We have to be very prescriptive with people's time. Obviously lower costs, having templates, those things go hand in hand, and lower, lower lead time or smaller lead time to implementation. Risk is always a challenge. You don't completely reduce risk, but the complexity, obviously, the more complex the design is, the more variables there are, and the less templatized there are. If you're creating things from scratch, you introduce risk. If you have templatized solutions that came from large pharma, you have less risk. The scalability, obviously, the more modular you get, the more scalable you are. I think SAP has helped us tremendously by changing their model with the private cloud. So you're not just buying one big license, but you're basing this on a full user equivalent or an FUE model. We certainly base our implementations on the functional footprint. We want you to have full exposure to the platform if you ever want to expand, but we don't want to implement and charge services for anything more than what is absolutely needed. And in some cases, this is as an MVP. We've been pre-revenue with certain companies where it has to be incredibly lean, and implementing in 33 days really is a testament to where that company was and where we needed to be time and cost wise. The knowledge transfer and training, can't compromise it. Sometimes it happens too late because people are building things from scratch. A huge advantage of having a templatized solution is we can also have templatized training, templatized change management, dealing with the same themes, and not have to charge consulting hours for developing training material and focus. And then, of course, we are laser focused in our group on life sciences. So we don't want to be the company that, I mentioned before, we have a lot of different verticals, but we have a very strong dedicated life science group, and we don't mix that. We have people that are well-versed. We have our own life science university for new people, and we have people that have been working in life sciences as solution architects for decades. They're the anchors for our implementation. Places where there's ambiguity and confusion, those anchors drive us, and they're the reason, frankly, that we can do a template like this in such a short time, because we have that knowledge built in. As much as we try to define a framework, we know that there's business problems and questions to be answered, and that's where we use those anchors.
So how did you design the UST SAP Bio PreFab framework to specifically address biotech sector needs?
Yeah, it's a great question, and I think when you look at this benefits piece, a lot of this was built into that. But I mentioned before the fact that, and I'll go over a little bit of the themes here verbally, but we want to make sure that we can deal with the solutions and themes that were built in. So the way that that are built into a pharma or life science solution. So the way that we do that is we've kind of taken over the years solutions that we have implemented, and in some cases it got incredibly complex. I mentioned, for instance, the subcontractors and tolling and principals and virtual transactions. Decades of doing those kinds of solutions, having Visio process flows, understanding the implications from a system and master data perspective, and being able to bottle those principles into building blocks, Bruce, was the basis of that. So we drove building blocks from a configuration perspective. We asked our clients to rely on our leadership there. The fact that we had done it at places that had invested, 5 to 10x what we're asking our clients to invest, millions and millions of dollars in driving what is the best practices for those solutions. We basically said, okay, we've seen this done in a lot of different ways. And when you start seeing the same business problem 10 times, you can say, okay, we can have a templatized solution in which we ask a couple of questions about key variables, and that will allow us to drive that solution. So it was really based on our history, as well as some accelerators that we've been doing in general, digital accelerators on top that helped us drive that. Ultimately, though, beyond just the functional footprint, which deals with the GXP quality, it's a separate session, but we have an embedded electronic batch record solution for small companies, weigh and dispense, shop floor equipment, electronic logbooks, all in SAP. You don't have to buy another MES, all in our template. And we did that because we saw the same themes. We know what weigh and dispense involves. We know the dispensing part, what's involved in formulation, cleaning rules associated with making sure that you're cleaned and calibrated, and embedding that into our template. We ask our clients to say, hey, start with the template. It may not be exactly, maybe 80%, but at least you have that template. And then the other piece, Bruce, that speaks to your question is just focusing on the accelerators throughout. So the part I mentioned before is specific to GXP and compliance. And we have a lot of tools around that as well, but really just kind of highlighting the steps involved, and those that are familiar with the Activate methodology will understand, some of these steps: prepare, explore, realize, and deploy. But every time that you see a star here, you see something that we've tried to dramatically reduce the time. Mm-hmm. So, and I'll just quickly kind of to take us through this. The prepare phase, of course, is when we're onboarding. The explore phase, which we view as the most important phase, is the one where our templatization is the most prominent. This is an example from where there was some procurement and finance integration, but in general, we like to do a discovery session before that allows our solution architect to come up with about 75% of the design. In this case, this was for procurement and finance integration patterns. It can be for anything. And running through our explore workshops in which we're actually driving it on the system. And I want to be clear, there is a lead time involved with provisioning the private cloud solution from SAP. Sometimes that can be 8 weeks. We've had situations where it's been longer. We don't want to wait because we believe that the explore sessions need to be system-based. In the old days, the blueprinting, which is the old name for explore, would have been something done on a whiteboard, and you have kind of like a mismatch of communication. You have the people familiar with the system, you have people familiar with the business, and they're not exactly aligning because they're not speaking each other's language. When we can bring the system at this phase, we can have templatized solutions. The client becomes aware in a very concrete way the way the system works, and allows them to translate their business challenges into language that our experts can then consume and curate and drive solutions based off of that. So really these star focuses, some of which involve some AI and some of which involve just best practices, are a huge focus. We use a fit to standard approach. So Bruce, you asked the question, how do we drive this to a bio and GXP? It's because our standard solution has already incorporated those key themes and building blocks that I mentioned earlier. And we really do challenge our clients to show us why they're unicorns. Why is the best practice SAP and what's tried and true for other customers not applicable to you? And I will say, you do have a natural inclination for folks to highlight exceptions because people feel like they're really demonstrating knowledge, and that's very important. But 80-20, we're really designing a fit to standard. We can deal with exceptions. We put a huge onus on our clients to drive why this shouldn't be standard. And that's really in everybody's best interest, because we don't want to design something that is incredibly bespoke for our clients.
So what role did automation and proprietary tools play in reducing the implementation time and risk?
Yeah, it's a great question, because I think as you get into this, and I would highlight this workshop A and B, which is done in Explore, all the stuff that we do in advance to prepare. In the old days, we would have a functional consultant come in. They obviously have their knowledge. They come with their knowledge, come with some general materials. Now what we do is we put a pretty heavy emphasis on a 2-day discovery workshop pre-project. And we use a lot of automation tools at this phase of the project around generating scope documents, generating flows, being able to understand pain points and overlay those pain points on those flows. In the old days, that would have been spending a lot of time in Visio and doing a lot of workshops. And then in the new world, it's quickly assimilating and organizing the output of our discovery workshop using AI automation and tools. It's creating visual flows. There's a lot of tools out there like Mermaid, which we use, but others in which we can take those flows, very quickly create a diagram which has pain points, overlay that, give that to our clients, overlay that with a URS, connect that URS to a traceability matrix, which has a list of test scripts, and then have the test scripts updated and curated. All of that now can be done with automation and AI. And we're infusing that, like a lot of other consulting firms, into our delivery method. It allows us to dramatically accelerate the time frame and dramatically reduce the billing hours our clients are paying for, because we have this level of automation. That's true probably throughout, but we also have a lot of proprietary tools inside SAP. And some of that, I would say, are things that are just best practices. And some of that are things like the electronic batch record solution that I mentioned earlier, highly differentiated, deviations, exception-based review, right first time, all those things. It's fairly uncommon that somebody would have that solution in SAP. We also have things like automated and digital tech transfer, digital thread for life sciences, CDMO solutions, just a lot of solutions that we built for life sciences in SAP. And that has also helped us, because it gives us a great starting point for some of the common business problems.
Mhm, mhm.
We also, Bruce, drive that in our build, which is the realize phase. So everything that I just mentioned around automation, including your question, speaks to the RISE spec and build. This again speaks to procurement and finance, but we have this for a bunch of life science specific RISEFs we don't want to charge our clients for. We want to make sure that they're a part of what we offer. In some cases, it can vary by industry. Regulated is different. We've done, again, things for like food and dairy and a whole bunch of things that overlap. But ultimately, we try to come in with about 80% of the design done, and we try to make sure that we can do a lot of our work in advance. In some cases, that's been as dramatic as doing our unit testing in our own UST system if the system's not provisioned. Best practice is to do that in a provisioned system. But as an example, we shouldn't have to reinvent a proper security framework using security role matrix for parent and child roles that is SOX compliant, that makes sure that understands the differentiation between quality processes, warehouse processes, manufacturing processes. Why don't we have that built? And those are the things that you see stars next to as well. And certainly during deploy, you'd expect this, but very clear cutover planning where it's going to vary based on business needs. But being able to drive these accelerators into our delivery is incredibly important to differentiating our solution.
Very interesting. I think the big question for me is, what enables Bio PreFab to achieve like a go live in like 3 to 4 months? How does that happen?
Yeah, and I think when you look at everything that I just showed here, Bruce, that's good, and certainly that helps. But what really enabled this to happen is being able to be out in front of key deliverables. The biggest thing, it's really 3 things I'm going to mention. On top of everything you see here, early change management. Now, you say you can't rush change management because change management was usually very serial after you have the design done and after there's some ownership by the business of the design. The ownership part doesn't change. Obviously, it's important just even from the optics and the psychology of adoption is that the client feels like they're owning the design, and that's incredibly important. But because the design is designed so early, we're not waiting to the end of Explore to do it. We can get way out in front of that. We can really focus on the big rocks, maybe the challenges, and there are some scary challenges. When you talk about change management, it's not that it's hard to build training material. When I think of change management, there's 3 pieces. There's training, there's client communications, which is basically making everybody aware, and then there's the org design. So, wow, I was really proficient in this old system. I'm not proficient in this new system. I wonder if I'll still be as valuable. Being able to be out in front of those kinds of discussions, to calm people, to give them an early look at what they're going to now own, to be able to translate what they used to know into the thing that they now will be moving to, are all not inhibited by waiting for 3 and 4 month blueprinting sessions. So my first answer to that question is early change management. The second answer to that question is strategic and risk-based testing strategies. And this does require some collaboration with the computer systems validation. If there is a group with our clients, we've had some that are very early stages, so we've been the computer systems validation, but making sure that we can align on a risk-based approach. It is something that is evolving by the year. It used to be computer systems validation, now it's computer systems assurance, which is really a risk-based approach. What level of rigor will we have for GXP? What level will we have for non-GXP? If there's solutions like NEAT out there, KNEAT, where they have automation, it makes it a lot easier. We can go live in 3 months. But even if we don't do that, being super out in front, not having to spend a lot of time on pre and post approvals for testing, incredibly important. And if you can do that and be strategic, you can go live in 3 months. And then the last is data. There is simply no getting around the fact that data can completely undermine an ERP implementation. If you haven't properly translated from the legacy world, which some cases is paper, to the new world. So there's no way around that other than early and often mocks. And the only thing I'd say there is if you're spending less time on the design, building it, you have the design early, then you can spend a lot more time early on translating the design to the data that the data owners, the process owners will understand. And the pieces I did want to mention, Bruce, that I neglected to mention earlier, SAP provides really nice best practices. We provide these solutions on top. And in addition to the configuration piece, which I mentioned before, tried and true, 20 years of pharma implementations, anything you can think of, tolling through 15 virtual legal entities, development organizations that are collecting revenue for services like storage, anything you can think of, which is more of a CDMO piece. We have very strong solutions and building blocks, intercompany, drop ship, those types of things, which are common to complex supply chains as well. Incredible adapters if you have an MES solution where you don't have to spend a lot of time building interfaces.
So, Chris, I'd love to hear, maybe you can talk about some case studies where we've seen this used.
Yeah, Bruce, that's great, because I think it's really nice to hear a consulting firm talk about these capabilities, but I always recommend the best way to do this is to talk to some of these folks. We've been very fortunate that we've had folks so excited about what we've done, and we've even spoken with them that they're very willing to give kind of an independent counsel for anyone that's wanting to understand these templates and solutions. So yeah, just to kind of I'll give the highlights of these without going into credible levels of detail. But PTC Therapeutics is one of the earliest really engineers and the earliest clients that we've implemented our prefab bio solution. In fact, as that was being developed, it was really an accelerator that wasn't named prefab bio template, but it was the same core tenets. And PTC Therapeutics was a company that very quickly had to get their internal manufacturing process up and running. To kind of summarize their story, they made a 5-year decision to choose Oracle Public Cloud as their ERP. And after year 1, they realized they needed to do internal manufacturing. And they actually engaged us to advise them on implementing internal manufacturing on Oracle. So we worked earnestly with the Oracle team and said, this is what we need to do. And they were incredibly dissatisfied with what they saw from both a functionality perspective as well as from a validation perspective. You remember earlier, Bruce, I was mentioning the GXP and the validation component of public cloud. It was incredibly cost prohibitive for them to do this. So they made an incredible decision to eat their 5-year contract and implement SAP and buy another 5-year contract with SAP and interface between the systems. And they, because of the nature of their acquisition, they had to be up and running in 4 months. We had to go live and get them onto GXP inventory in a 4-month timeframe. And that was a pretty significant deal for anyone that, this is internal manufacturing. We actually did it in stages. We did the raw material receipt, quality, master data first, and then we did the second piece around their bills of materials and routings. As we stand there with them now, they have an incredibly robust implementation. They've spoken about this. They've retired Oracle and moved over completely to SAP, and we helped them on that journey. And now they are turning on the lights for many of the rooms of the house I mentioned earlier, with some of the advanced features of their platform, intelligent clinical supply management, for instance, supply chain collaboration with their CMOs. They're looking at batch release hub, and they're incredibly happy with the platform, a platform which was built with the prefab bio template initially in 4 months, and now they're 4 years into this journey. So it's really exciting. Another internal manufacturing story, Just Bio Evotech. This is a CDMO. So those that are familiar with this, you typically build that on project systems using WBS elements so that you can connect the sales, billing, and revenue recognition with the operational model, so the revenue model to the operational model. SAP has a great solution there, but it does require a little bit of changing things around, the way you settle process orders, the fact that you're not selling product, you're selling services, but shipping product. We implemented that solution globally, did it in Europe and did it in the States. They retired IFS, which was their legacy solution. There's one other example I have, Bruce, I'll just give it to you verbally, which is we actually did an implementation in 33 days. And that was from provisioning to go live for a life science company called Calvista. We just went live. And that's close to a miracle. 33 days for a life science company is a miracle. I will say we spent a few months in advance preparing on the UST system, but if anyone who has any exposure to life sciences hears from provision to go live 33 days, they would probably think we're crazy, which is why I certainly would love I'd love the opportunity to talk more about that with anyone, as well as give folks a chance to talk to this client, because they're also excited for the story. That was an incredible level of pressure. I think we had a discussion in December, and they said we need the go live to happen in June, and the system provisioning just for things that UST couldn't control didn't happen until May, but we went live at the end of June. So it was an incredible story of the prefab bio template, maybe the best example.
You know what? That's been a fantastic overview, and really excited to hear. And thank you for the time. Did you have any closing thoughts, Chris, before we wrap this up?
Yeah, no, what I would say is it's always nice to talk about a particular situation. The challenge with sessions like this, Bruce, is you're speaking very generically, and as much as the case studies are nice to see, definitely invite anyone in the audience to explore this further, ask specific questions, as well as overlay their situation. I mentioned before a great model in which we want to prove ourselves to you and give you value, and kind of like that first date, make sure you're comfortable with things before we proceed. And to that end, love to get into any more detail that would ever come from any of the audience members, but also appreciative of everybody's time here today watching this.
Chris, has been fantastic. Very detailed, a lot of great information, and thank you for taking the time out of your day to do this and share this with the audience. And I wanted to thank everyone for joining. For more information, you can click on the QR code at the bottom of the slides here, and it'll take you to all the information that you need for the prefab bio for SAP S/4HANA. Thank you once again, everyone, for joining us. Thank you, Chris, for this very robust and thought-provoking discussion. And I wanted to thank everyone and have a fantastic day and rest of your day.
Thank you, Bruce.